Greetings, my friends. Welcome to my show. This is Dr. Jaime Daniel, and today I will share with you an overview of Epidermolysis bullosa. It is a group of rare diseases that cause the skin to be fragile and to blister easily. Tears, sores, and blisters in the skin happen when something rubs or bumps the skin. They can appear anywhere on the body. In severe cases, blisters may also develop inside the body, such as in the mouth, esophagus, stomach, intestines, upper airway, bladder, and genitals. Most people who have Epidermolysis bullosa inherit a mutated gene from their parents. The gene mutation changes how the body makes proteins that help the skin bind together and remain strong. If you have Epidermolysis bullosa, one of these proteins does not form correctly. The layers of the skin do not bind normally, making it easy for the skin to tear and blister. The primary symptom of Epidermolysis bullosa is fragile skin that leads to blistering and tearing. The symptoms of the disease usually begin at birth or during infancy and range from mild to severe. There is no cure for the disease. However, scientists continue to research possible treatments and cures for Epidermolysis bullosa. A doctor may focus to treat the symptoms, which may include managing pain, treating wounds caused by the blistering and tears, and helping the patient to cope with the disease. Anyone can get Epidermolysis bullosa, and it affects male and females equally. There are 4 major types of Epidermolysis bullosa. The skin has a top or outer layer, called the epidermis, and a dermis layer that is underneath the epidermis. The basement membrane is where the layers of the skin meet. Usually, we can determine the type of Epidermolysis bullosa based on the location of the changes in the skin and the gene mutation identified. We can say that the first of these types is Epidermolysis bullosa simplex, and it happens when blisters occur in the lower part of the epidermis. Second, we get the junctional Epidermolysis bullosa. Here, the blisters occur in the top portion of the basement membrane due to problems in attachment between the epidermis and basement membrane. Third, the dystrophic Epidermolysis bullosa. Here, the blisters occur in the upper dermis due to problems in the attachment between the basement membrane and the upper dermis. And finally, we got the Kindler syndrome. Here, the blisters happen in multiple layers of the skin, including the basement membrane. The researchers have identified more than 30 subtypes of the disease, which are grouping under the 4 major types of the Epidermolysis bullosa. Knowing more about the subtypes, it can help us to treat the disease in a better way. There is a 5th type of the disease, Epidermolysis bullosa acquisita. It is a rare autoimmune disorder that causes the body's immune system to attack a certain type of collagen in the person's skin. Sometimes it happens with another disease, such as an inflammatory bowel disease. Very rarely, a medication causes a disease. Unlike the other types of Epidermolysis bullosa, the symptoms may begin at any age, but many people develop symptoms during middle age. And talking about the symptoms of Epidermolysis bullosa, they vary depending on the type you have. Everyone with the disease has a fragile skin that blisters and tears easily. And there are some other symptoms, and they depend on the type and subtype. For example, those who have Epidermolysis bullosa simplex is the most common form of the disease. People who have a mild subtype develop blisters on the palms of the hands and soles of the feet. In other, more severe subtypes, the blisters occur over the entire body. Depending on the subtype of the disease, you can show things like thickened skin on the palms of the hands and soles of the feet, rough, thickened, or absent fingernails or toenails, blisters inside the mouth, and changes in the pigmentation of the skin. And about those with the junctional epidermolysis bullosa, they need to remember that it is usually severe. People who have the most serious form can have open blisters on the face, trunk, legs, which may become infected or cause severe dehydration due to fluid loss. The blisters also can develop in the mouth, esophagus, upper airways, stomach, intestines, urinary systems, and genitals. There are some other symptoms, yes, like rough and thickened or absent fingernails or toenails, thin appearance to the skin, blisters on the scalp or loss of the hair with scarring. Also, we can see malnutrition resulting from poor intake of calories and vitamins due to blisterings in the mouth and gastrointestinal tract. As also, we can see anemia and a slow overall growth and poorly formed tooth. In the case of those with dystrophic epidermolysis bullosa, it has slightly different symptoms, depending upon whether the disease is dominant or recessive. However, most people have the recessive subtype. In the recessive subtypes, we can find symptoms that vary from mild to severe, like blisters that usually appear over large areas of the body. In some milder cases of the disease, the blisters may only appear on feet, elbows, and knees. It can present also a loss of nails or rough or thick nails. The skin scarring, which may cause the skin to be thick or thin. Also, you can find hemilia, which are small white bumps on the skin, itching, anemia, and slow overall growth. The severe forms of the recessive subtypes may lead to eye damage, tooth loss, blistering inside the mouth and gastrointestinal tract, and fusing together of the finger or toes. There is also a high risk of developing skin cancer. This cancer tends to grow and spread faster in people with epidermolysis bullosa than in those without the disease. In the case of the dominant subtypes, the symptoms may include things like blisters only on the hands, feet, elbows, and knees, change in shape of nails or nail loss, milia, and blisters inside the mouth. And last, those with Kindler syndrome. It does not have any subtypes, and the blisters can form in all layers of the skin. The blisters usually appear on the hands and feet and, in severe cases, spread to other areas of the body, including the esophagus and bladder. There are other symptoms that include thin, wrinkled skin, scarring, milia, and sensitivity of the skin to sun damage. Mutations to genes that you inherit from your parents cause most forms of epidermolysis bullosa. Genes carry information that determines which features are passed to you from your parents. We have 2 copies of most of our genes, one from each parent. People with the disease have 1 or more genes that carry the incorrect instructions to make certain proteins in the skin. And there are 2 types, the dominant and the recessive. The dominant, which means you inherit 1 normal copy and 1 copy of the gene that causes epidermolysis bullosa. The abnormal copy of the gene is stronger or dominant over the normal copy of the gene, causing the disease. A person with a dominant mutation has a 50% chance of passing the disorder to each of his or her children. Those with the recessive, they need to remember that it means that your parents do not have the disease, but both parents have an abnormal gene that causes epidermolysis bullosa. When both parents carry the recessive genes, there is a 25% chance per pregnancy of having a child with the disease, and there is a 50% chance for pregnancy of having a child who inherits one abnormal recessive gene, making them a carrier. If one parent has a recessive mutation of the gene, all the children will carry an abnormal gene, but will not necessarily have epidermolysis bullosa. Researchers know that epidermolysis bullosa acquisita is an autoimmune disease, but they do not know what causes the body to attack the collagen in a person's skin. Sometimes, people with autoimmune inflammatory bowel disease also develop epidermolysis bullosa acquisita. Rarely, it's caused by medication. The diagnosis of epidermolysis bullosa is done by asking you about your family and medical history. Remember, most types of epidermolysis bullosa are inherited. Also, a complete physical exam and a close examination of the skin can help to identify where the skin is separating to form blisters. Also, perform a skin biopsy and reviewing it by using special microscopic techniques helps to identify which layer of skin are affected and determine the type of epidermolysis bullosa the patient has. And ordering a genetic testing is a way to help to identify specifically which gene mutation the patient has, and also helps to diagnose the type and subtype of the disease. People who have genetic testing should see a specialist or genetic counselor to help them to understand the results. There is no cure for epidermolysis bullosa. The treatment only helps to prevent and control the symptoms by doing things like managing pain and itching, protecting the skin and caring for blisters and wounds, treating and preventing infections, maintaining or restoring mobility, and maintaining good nutrition. The skin care is an important part of treatment epidermolysis bullosa because the blisters can be large. It is important to care for the blisters and wounds to help prevent loss of body fluids from the blisters and prevent infections of any wounds. Changing bandage is an important step in protecting the skin and caring for blisters and wounds. Probably your healthcare provider will give you directions on changing the bandage. When possible, use non-adhesive bandage. Sometimes the bandage still sticks to the skin. If this happens, your doctor may recommend you to soak in the area in warm water to help loosen the bandage. You can help lower the chance of developing an infection by washing your hands before providing skin care or changing dressing, by applying topical antibiotic creams as recommended by your doctor, staying healthy by eating a nutritious diet and following your doctor's recommendation. Even if you take precautions, an infection may still develop. If you see any signs of infections like increased redness, increased pain in a skin lesion, red streaks coming from the wounds or blister, pus, fever, please look up for help with your healthcare provider. Living with epidermolysis bullosa can be hard. However, taking steps to care for your skin to help prevent blisters from forming and getting help to cope can help you. To minimize friction and to stop tears and blisters from forming, you can get some recommendations like keep your skin cool, never apply anything hot to the skin, and avoid using water warmer than your body temperature when bathing. Wear loose-fitting, soft clothing to avoid rubbing against the skin or causing friction. Avoid overheating by keeping rooms at a cool, even temperature. Apply lotions to the skin to reduce friction and keep the skin moist. Use sheepskin on car seats or other hard surfaces. Wear mittens at bedtime to help prevent scratching while sleeping. Maintaining and caring for Epidemorlysis Bullosa may be hard. You may find it helpful to find a community or online support group. Some people may find it helpful to speak to a mental health professional about coping with this disease. And I hope you enjoyed this episode, and we will see you in the next one. Thank you.